Menopause, which occurs in women by age 50, is accompanied by a decline in estrogen, progesterone, and androgen levels. Menopausal estrogen is purely derived from the peripheral conversion of adrenal androgens. Estrogen decline is not an isolated process as it is accompanied by reduction in pubic hair, loss of fat around the pubis, atrophy of the labia majora, and loss of elasticity in the vaginal barrel, atrophy of the Bartholin glands, as well as a decline in the number and maturity of vaginal cells, are associated with a reduction in the volume of vaginal secretions. The vaginal epithelium, which is highly estrogen dependent, becomes flattened and loses glycogen. This leads to a decrease in lactobacillus species and lactic acid and an increase in vaginal pH. All these changes in the vaginal area increase the risk of bacterial infections. Apart from vaginal dryness, thinning in the epithelium leads to postcoital bleeding, mild burning sensations following intercourse, and pain. Decreased estrogen stimulation is also followed by 30 to 50% reduction in the size of the uterus. The uterine cervix also atrophies and loses fibromuscular stroma, and the ovaries, with no remaining follicles, become reduced in size and weight, and the ovarian stromal tissue becomes fibrotic and sclerotic. Estrogen therapy, while having the likelihood of reversing all the outcomes listed above, increases the risk of breast and endometrial cancer. Vaginal blood flow and genital engorgement are less intense than in younger women and take longer to occur in the excitement phases of a woman, with this phenomenon being less pronounced among sexually active women, whereas younger women take approximately 15 seconds to lubricate. Menopausal women might require around 5 minutes. The decrease in vaginal vasocongestion and lubrication may contribute to dryness of the vagina and may make intercourse painful. Women who don't like external lubricants during intercourse could opt for non-hormonal preparations such as Replens or oil from a vitamin E capsule, applied vaginally every other day reduce vaginal dryness, with the same effect being achieved by orally administered zinc. The plateau phase of sexual response is prolonged among older women, uterine elevation is reduced, the labia majora do not elevate to the same degree as it did in their younger years, the breasts become less vasocongested, and nipple erection is less likely to occur. Women retain multi-orgasmic capacity, although the number and intensity of vaginal and rectal contractions reduce from 5 to 10 contractions to 2 to 3.